Spinal cord injuries. I am actually, again, one of the few things I will say, happy to report are relatively rare. Okay, we get anywhere between 3 to 4 serious spinal cord injuries a year. However, unfortunately, a spinal cord injured patient is probably the most dependent patient that we can have in a medical system, depending on what level of the spinal cord has been injured. If you have lower level spinal cord injuries, you can deal with paraparesis and paraplegia, where they're unable to walk easily and you have issues with maybe a wheelchair or two. But the higher up you go, it is the more the body is affected. So when the very high spinal cord injuries that affect the neck, where you have broken necks, they can affect not only all 4 limbs, both arms as well as the legs, but also they may affect their diaphragm, which is the muscle for breathing. And sometimes some of these patients require ventilation. And as a result of that, a spinal cord injured patient can run anywhere from a ventilated, totally dependent on nurses for bodily functions, whether it is to stool or urinate. And they can't move or scratch, and they're basically prisoners in their own body. Young men are, in terms of the ratios, overwhelmingly affected more than young women or women of any other age group. There's also another peak in the older age group where you have the little old person, again, usually an old man, going to the bathroom. It can occur with old women too, but again, it's predominantly male. But they go to the bathroom and they slip and fall. And as a result of that slipping and falling, they hit their head and on the toilet bowl, and they get what we call hyperextension of the neck. And that can cause paralysis of all 4 limbs as well as the diaphragm.